So thank you very much, everyone, for joining. Thank you to Simona, who many of you will know, Dr. Balestrini, who is very involved in AHC, both clinically and in research, and is both at University of Florence and the University College London. So Simona, I don't know, for those that aren't familiar with you, I just wondered whether if you could just say a couple of words about how you got into AHC clinically and also research-wise, just to kind of share with those that are not familiar with you.
Of course. Thank you so much, Katrin. Thank you everyone for joining late this evening. I am a consultant neurologist. I've been working at UCL in London for about 10 years. I'm still working there. And recently, a couple of years ago, I also started this position in Italy as a child neurologist, which for me is really interesting because I've always had interest in rare genetic condition, especially in rare genetic condition with epilepsy. But I always only seen the adult side when I was working in the UK. And now I have the opportunity to see also the pediatric side, which probably you all know very well, for example, for the AHC. And I think it's really important because, of course, I have kind of both view how all these rare conditions start, the onset, and how they evolve over time. And then I also know how they tend to evolve. So I'm glad. I was a bit worried at the beginning, but now I'm glad I accepted it. And so my interest in HC started when I was working in London, because I've been working with Sanjay Sisodia, whom you probably all know. And he was, of course, already very involved in lots of research in HC. We started together the follow-up study on the cardiac feature of HC. So we collected, for example, all the ECG study of a quite relatively large multi-center cohort of people with HC, but also other ATP1A3 related conditions. And we found specific abnormalities by looking at the ECG with the help of our cardiology colleagues at Gauche. That was a really important study, I believe. And then we have always been collaborating with the Duke University. We are involved in the Observe AHC study led by Professor Mikati at Duke. And then, of course, we see people, mainly we see adults in London, of course, with HC, but also with Kaplan syndrome. We don't see really many of the dystonia and Parkinson's phenotypes. And then because our main focus is epilepsy really at UCL. But then now working in Florence, we see, of course, children with HC. We have seen children with also the novel condition that has recently been described, which is a very severe encephalopathy with also cortical malformation. As you know, the spectrum of condition is really, really wide. So probably was too long as an introduction, but my interest in HC is really deep, and also because probably I think the ATP1A3 is the prototype of how complex a genetic condition can be, because phenotype can be so different, and course over time can be so variable, and also the same type of phenotype, such as HC, even just within the same phenotype, there can be so much variability. And so after studying the cardiac phenotype, I thought it could be interesting to study a bit more in detail the sleep phenotype. And why is that? Well, first of all, because intrinsically we all know that somehow there is this association between sleep and hemiplegic episodes. One of the initial ICARD criteria for the clinical diagnosis was the resolution of the hemiplegic episode upon sleep. And so I always thought, okay, there must be something in sleep that happens that somehow attenuates or resolves the abnormal brain state that there is during the hemiplegic episode. So that was one kind of aspect that led into this specific research. And then there was this more recent study led by Duke University, where they studied children with HC, about, I think, 2022, and they look at the polysomnography recording. So polysomnography is a type of investigation that looks at some aspect that occur during sleep. They don't really look deeply into the EEG. In fact, EEG recording usually not included, but they look especially at the breathing pattern. They look at the arousal, so how many times people wake up, and they look at the oxygen saturation in the blood. And they found a number of abnormalities in these children that were recorded with polysomnography. And so following this study that involved only children, they recommended that all really people with AHC should have at least a first assessment that includes a nocturnal polysomnography and clinical assessment of sleep as part of the routine care. And then, of course, because some children also had sleep apnea, and that could be related for example, a ENT condition like increased adenoids or tonsil, then they also suggested an ENT evaluation. But this is a slightly different aspect, although it can, of course, affect sleep. And when the sleep apnea can be very severe, they also suggested considering a treatment such as like non-invasive ventilation at night, which, of course, is not really ideal. But if the sleep apnea are severe, then this should be considered. And so, of course, this is one first aspect for which we have some evidence, because I think this study was really well conducted and they really looked at the possible sleep abnormalities related with apneas. But then, as I said, I also thought that studying sleep could be important because there could be some underlying mechanism that happen during sleep that can lead to the resolution of the hemiplegic episodes. And that's different for seizure because, for example, in our patient cohort, it was clear that seizure do not really follow a sleep-wakefulness pattern. So most of our patients with AHC and epilepsy can have seizure independently from sleep or wakefulness, while different, of course, is the case for the hemiplegic episode. So I thought that by studying sleep a bit more deeply, we could understand a bit better disease biology. And then also, last but not least, of course, there is a associated risk for comorbidities because sleep impairment can lead to cognitive impairment, first of all. We know that people with epilepsy, this independent of AHC, have an increased risk of mortality due to SUDEP. This is a kind of sudden type of death that we cannot really fully explain, but is somehow associated with a seizure arising from sleep. So the mechanism between sleep, seizures, and other conditions where there are paroxysmal episodes is very complex and not fully understood. And so we already conduct on this basis, so this is the context, and on this basis we already conducted a very small study in our adult cohort in London, where we studied 5 adults with AHC who had prolonged EEG recording, and we analyzed EEG not only in terms of burden of epileptiform abnormalities, but we also looked at the changes in frequency of the brain, first of all between wakefulness and sleep, and then also just before, during, and after an hemiplegic episodes. And it was very interesting because we found that although, as you know, if we do EEG during a hemiplegic episode, we don't see a change, an obvious visual change on the EEG. So the brain activity doesn't change because that only happens if we record seizures. But still, when we did this more sophisticated analysis by extracting the spectrum of frequency that the brain had, so the oscillation with which the neuron tend to oscillate during each kind of different brain state, we saw some changes that were lateralized during the hemiplegic episode. And that seemed to happen up to 10 minutes prior to the event onset, such as like some preparation of the brain that was changing its state of oscillation before the hemiplegic episode. And that changed then during the episode, that kind of normalized after. But of course, this is very preliminary. It's only 5 patients, which is very, very little, it's very small sample. And so we are now extending this study, and we are collecting, actually, we have already collected a much larger cohort through the consortium. We now have, I think, over 70 patients included, and we are going to analyze the EEG in the same way. And I think this will be helpful to understand more. Maybe we won't confirm this pattern we saw in this initial small cohort. Maybe we will find something else. I don't have additional data yet, but I think it's interesting. But then I thought that, of course, this will give us detail about the EEG, but does not really allow us to fully characterize what happened during sleep, because actually this is what you as families know much better, and sometimes the clinician, because usually also when I'm in clinic, we of course talk about the epilepsy, we talk about the hemiplegic, we talk about the dystonia, which, I mean, they are the, of course, probably most disturbing type of episode. And so we do not often discuss sleep that much in clinic. And so we thought that a questionnaire that could be administered directly to the family may be helpful in this sense. Okay, and so we designed this questionnaire. We thought about this 35 question. Katrin and Rosaria Vavassori from Italy also help us a lot in designing this questionnaire with multiple choice. And then we also thought to add a scale which is a bit more validated. So this is more robust in terms of assessing sleep disturbances, and that is called Pittsburgh Sleep Quality Index. And we had to ask permission to the, let's say, owner of this questionnaire, but we got that. So we got that in English and in Italian at the moment. And of course, we then distribute this electronically, as you know, with a link that we can share also at the end of this presentation. And I just extracted some screenshots from the questionnaire, but basically we try to write this in lay terms as much as possible, so hopefully it's easy to understand. It doesn't use too many medical terms. We ask basically of giving us an idea of the past 6 months from when the questionnaire is being completed. And then, of course, there are some open space where anyone can add any comments. And of course, eventually the survey can be filled by the person with HC, but if that is not possible, also a parent or relative can answer on their behalf. There are some general clinical questions to characterize the condition. So like frequency of epileptic episode, frequency of dystonic episodes, frequency of arousal, so how many times people wake up during the night and why. And then we also ask some specific questions, for example, about the different type of paroxysmal event. And in particular, of course, if the hemiplegic episode, but also the other type of episode, because as you know, the episode type can be really variable, and the relation of each of them with sleep. And we also ask some questions about environment. So, for example, if there is the use of a monitoring device, then now family in general tend to use more and more the use of light, the use of music or noises during sleep. And then finally, we have this validated questionnaire, which is the Pittsburgh Sleep Quality Index, which really investigates in a more kind of consistent way and substantial these sleep habits. And these only refer to the past month. And I think that's it with my short presentation, because I really wanted to give you an idea of the general context in which we are running this study. I wanted to mention the EEG study, which we are also conducting in parallel. And I think many of your clinicians have participated to that, because, of course, for that study, we need the clinician as a kind of mediator to upload, send us the EEG, send us the episode that have been recorded, and so on. And then this second part of the study, which is directly addressed to the family, which is the sleep questionnaire. And here is the QR code, which I hope will work in case you want to just have a direct access to the survey. But of course, we can share also the actual link later.
Lovely. Thank you so much, Simona. There might be quite, some questions which would be great from anyone. You can put it in the chat or pop your hand up. I just wondered, could you tell us the time frame of your study in terms of the questionnaire has started, and you're looking to complete it at what kind of point?
Yes.
And the same for the EEGs. And then linked with that, obviously, there may be some other, I know we've got some other people from other countries around Europe on the call. If they want to look at getting involved, because it's translated, is obviously in 2 languages at the moment. If you could also give them some information about that, that would be great.
Yeah, thank you, Catherine. So, first question, well, I had hoped to finish the study. Actually, the study should have already been finished, but then there was the COVID pandemic and there was a big kind of, there is lots of bureaucracy now with this multi-center study. Because I started it through UCL, they wanted a specific legal document in order especially to share the EEG with the videos, which took us so long. And I'm so sorry that actually some center from, for example, I think Poland had to drop because it was too complicated from their legal office. So this is just to explain why we had so much delay. And given the delay now, I think we are okay to extend the study at least till the end of this year. So especially for the questionnaire, I think for the EEG now, most center gave us feedback. We completed the document, they have uploaded. So now it's more up to us to do the whole analysis, and we may go back to the clinician. But I think for that, we are more now close to the data analysis and interpretation. But for the questionnaire, I think it's fine for us to collect data for another 4 months from now.
Great. And I know we've got to spread it more in the UK to try and encourage people to fill it out. And I think, there's so many surveys people can get that you can get a bit tired of like filling things in. But it is really important, as you've explained, there's clearly something that you need to investigate more with the EEGs, and the sleep study questionnaire, the sleep questionnaire helps the families give their voice to it, doesn't it? So I think if the families kind of understand that they can kind of really give so much information to help you and the other researchers understand it, it's really quite powerful. Even though many families are tired just juggling AHC every day, it's so important to kind of collect that information, because every child and adult is so different, as you've said, and looking at how the person sleeps and how the family or the person with AHC can explain that to you is really important. So if anyone's on here from the UK who hasn't filled it out, please do. And then for anyone who's from other countries, what would you suggest?
So that's a difficult question, because I really would like to, of course, extend this as much as possible. But then for example, even just the experience, because of course, initially we designed this in English and then we translated to Italian, mainly because of course I knew I was going to also in Italy, and I had also connection with the different families there. So I said, okay, maybe a good starting point would be Italy and English. And also because I have some degree of control on the language, which I can understand both. But now I would be a bit more worried about other language, which of course I do not understand, and for which because even just for the translation, we need both families and clinician to make sure that, of course, the meaning was preserved. And then the other problem is the Pittsburgh Sleep Quality Index, which I think is available in many languages now, but also the process to request it is a bit complicated. So for all these reasons, we thought to start with Italian and English to have an, of course, initial idea. And then depending, of course, on the responses, then we would be very happy to extend this and start translating in other languages. But for the aim of the initial, at least, study, the way we thought it, which was to give us an idea of course, of what is the perspective and the burden of sleep issues from the patient and family perspective, to add then to the EEG study, which is a kind of more quantitative and objective way to then assess sleep. We thought it could be okay just to start with the two countries. But then I don't know, I mean, if there are families that cannot fill it in English and we think it's a good number of families, I'm happy to reconsider the idea. So I don't know if you had feedback from some specific countries or some families from some countries, I don't know.
So what we were going to do today is, with this recording, put subtitles in and then translate it. And the subtitles, and I was speaking with Mariana from AHC France before the meeting about doing that. And I know that some others are on. I think I saw Bridget from AHC Spain as well. So it might be that they want to then have a chat with their community to see. Feel free to speak now if you want to, Marianne and Bridget, or maybe we could kind of connect by email with Simona afterwards. But what you're saying is anyone can fill it in if they're comfortable in kind of English or Italian. And then if people are kind of inspired to actually say, no, I would like to somehow work out how to do this with both the clinicians in their country as well as the groups that they might represent in this country, then to get in touch with you.
Yes,
would that be right?
Because we now know quite a few clinician experts in AHC in most countries, so I think we can definitely ask them. But then on the other hand, I mean, many of them have already been involved and worked hard in helping collecting all the EEG work. So I really didn't want to ask them, because doing the translation properly took time, even just for us to do from English to Italian, because of course we also need the feedback of families, if that is understandable. There is not always a direct translation, so there is also a risk of having kind of not so homogeneous results when you interpret them, because the question might be slightly different. So I'm very happy to consider that, as long as we think there is a good number of families that really wants to fill the question in their own language, which of course is perfectly understandable. On the other hand, if we have families that are happy to do it in English to start with, that probably will be easier.
Perfect, great. That's lots to think about for everyone. I know there's a network of people across Europe that are trying to translate other documents in conjunction with an expert in their country with AHC, and that's definitely made some progress in doing that. So it might be something for the future to chat with the rest of the Europe associations. Has anyone got any questions? I can see Mariana is typing something. So I'll just see what she is about to ask. Can I ask you? Oh, she's not. How many completed questionnaires did you need for the study? Good question.
Well, okay, yes, that's a very important question. We did not really do a power calculation, like in the sense we just thought, okay, we would like to collect as many as possible from representative of patients from 2 countries to start with. We actually had a very good response in Italy. I think in Italy we collected like 30 questionnaires in the first couple of months. We just had response from most families. And I thought that if we had even just the same number or less from the UK, that would be super. So yeah, I don't have a specific number in mind. I think yeah, we don't have a kind of cutoff.
Perfect, thank you. Yeah, we are going to heavily plug it again to try and get our numbers up, and anyone who wants to fill it in across Europe as well can fill it in, and I suppose worldwide, anyone who wants to fill it in. Any other questions, pop them in the chat. Bridget's asking one. In the meantime, could I just ask while Bridget's typing, it's really interesting what you said about 10 minutes prior with the EEGs, because there's a lot of families that would say they see some kind of behavior change before in their child, the ones that maybe are more non-verbal, and then some that are verbal might be able to kind of just express that they're feeling some strange things. So that is very interesting. And your studies with that in adults was when they were asleep. Do you have something when at the EEGs when they're awake to kind of, you know, correlate that at all? Or do you think it's more when they're asleep that there's a building momentum before?
So the analysis, I mean, that analysis was really difficult because of the very small sample size. So what we did, we compare. So first we compare independent of any episode that was captured. We only basically compare the wakefulness and then the different stages of sleep. So the light sleep and the more deep sleep. Between the 5 patients with AHC, and we had controls, like we had 2 controls for each patient, but then they were patients with epilepsy, because of course we did not have prolonged EEG recording for a healthy control. And we tried to at least choose control with the well-controlled epilepsy. So these were all people who had not had any seizures for the previous 6 months. So at least we did not have the confounding effect of seizures. And so by doing this comparison, we did not find any significant difference between each, like, wakefulness between patients and control, and also the various phases of sleep between patients and control. And then we did this second level of analysis where we only looked at people with AHC, and there we looked at differences in these kind of spectral frequencies between like we cut, I think, the half an hour before each event that we recorded, and then the episode itself, and then half an hour after the episodes. And so we did not really have a comparison. That kind of change in the frequency we only saw just before the events, because we looked at that kind of sequence. We wanted to know really what happened. Otherwise, it's normal to have anyway changes in the brain state, even just during wakefulness. That's normal in also healthy subject. But it seems that there is anyway, at least from this small analysis we did, it seems that something happened, definitely. And as you say, that can have also clinical correlate, which we don't know yet, and that may be variable from person to person, but definitely something in the kind of brain oscillation changes, and that may lead up to the event and then gets restored. And in fact, one thought I had is that then perhaps sleep may be one of the mechanisms which help restoring then the brain state that is present prior to the episodes.
Yeah, that's fascinating. I think one parent once said in America that if you could bottle what's in a sleep, that would be an amazing medicine for AHC.
Yeah, but also equally, perhaps at least we could use this as a sort of biomarker. So any drug or treatment that will be proposed or studied, then one could see, okay, if we can kind of control that change that happened before the event, if that kind of treatment can be targeting that aspect.
Yeah, that's fascinating.
Response. But this, of course, is very, very preliminary. So I think that the starting point is to expand these findings.
Yeah. Thank you. And we've got one question. I'm sorry I don't know your first name, but would you like to go ahead? You're the only person with your hand up. So it's JP Portahu. Go ahead.
JP, Jean-Philippe Porto. I've got I filled the questionnaire. We did the study with our son.
Thank you.
The way it happened during the polysomnography and the way I answered the questionnaire, he was in a real, he was pretty much in a good state at the time, and like 2 months later, he wasn't at all in the same state. So it seemed to me that the way I filled the questionnaire, it was a bit biased because I didn't really necessarily answer the way it was when he was like having episodes more often.
Okay, thank you.
This is really important.
So how do you take it into account?
Well, I think we had a chat about this, Simona, when we were trying to develop the questionnaire, and then that's why we kind of looked at the 6 months before. But I remember having a similar thought, JP, that, you know, every single day is different. Every week can be different. And where do you do the overall thing? And yeah, it'd be interesting to see what you think, Simona, and whether you need serial things. I don't know, but
no, I think really you told me the same, Catherine. And in fact, you know, it's so important to always have this exchange with you, because it always kind of make us think more, and now we can study things better. Maybe it's true. Maybe saying 6 months is definitely too superficial, and we don't capture the variability. So maybe actually. It's interesting because none of the Italian family who filled the questionnaire had this comment, but maybe they just try to get an average. But I wonder whether actually we can find a way to allow the family, even families that have already filled the questionnaire, if, for example, they think that since the time they filled the questionnaire, the situation of their child had changed, then to fill a second time. But then we need to find a way, because as you know, the survey is of course anonymous, so we need to find a way to. I think that's difficult though, because we don't have a link, unless, I mean, I think we ask. I don't remember if we removed that or not now, but if they have the code of their patient that can be linked to the EEG study to disclose that. But I don't think that applies to too many. So that would be difficult.
I think this is it's a really good point that is raised, and I do remember having a chat. So it is tricky, and probably some families might find, where do they start? You know, I suppose that might make them kind of think, how do I fill it in? I know for us, we see sleep is worse on the days that she has had AHC. So then that might also vary with different people having AHC episodes and different frequency. Yeah. So, JP, did you have something else that you wanted to add with that? Sorry.
Yeah, if I may, what I would maybe could the easiest way maybe could be to consider it at the peak, at the most, at the peak of the episodes, to consider the peak of the episodes and not all the most average situation on everyday basis. Two solutions: it's either the everyday basis or the peak.
Yeah, that's a good suggestion. My only concern is that now I think it's very difficult to change the questionnaire, given that of course some families have already filled the questionnaire. But so what I think probably what we could do for now is to, if you could use all the blank spaces to really kind of explain this, because then I think of course we will take that into account. And as I said, this survey is really to help us to really understand the size and the main feature of the clinical issues. It's not, I think, the perfect way to really analyze, because as you say, I think every person is different, and then every person is so variable in their specific presentation. And I think we need to think of much better ways to try to capture that variability and the spectrum within the same person, and perhaps even within the same months. I think from all what you're saying, maybe even within the same months, you won't have the same sleep quality every night. So Joyce.
Yeah, I think we did discuss like encouraging people to fill in that box if it was really, because I think I remember it's a while ago since we did validate the study within, you know, the committee as well. And I think a lot of them filled in the box at the end in detail saying, you know, it's really the highs and lows can vary quite a bit, but then for some it might not vary as much. So, you know, you might have you know, a more consistent thing. So yeah, we probably need to share and promote it and encourage people to fill in that box to help you. Joe's got something. I'll just see what she's said.
Joe is suggesting that, of course, families, carers could repeat the questionnaire and then saying in the comment box that they are completing it for a second time, explaining why they're doing that, which is, of course, absolutely possible. I think that then for the way we will be analyzing it, we cannot, I think, taking the same person represented twice, or we can find a way to correct for that, I guess. But at least that will give us an idea of the variability, because of course, if we have 50% of people that are completing it twice because of the variability of the person with HC, that is already a very significant, I think, finding per se. So yes, absolutely. I think feel free. Of course, I don't want to take, even more of your time, because of course, completing it for a second time, but if you can, and if you think that for everyone that has completed it already, if you think that the situation has already changed, and I will actually, this is a very good point, I will discuss this also with the Italian families, if they think that the situation has changed since the first time they're completing it, then yes, because as we said, we have at least other 4 months. So yes, please fill it for a second time. That would be great.
I think that's a great idea to put it in the box at the end. And I suppose in your analysis, you could just have wave 1, wave 2 for each patient. You know, if someone had filled it in 5 times, you just have each wave along
each. We won't be able to recognize the patient, so we don't know if
no, that's true.
Fill a second time, we won't be able to do. Oh, that would be ideal, but this is not, as you know, it's not a prospective study where we have.
That's true.
We can't do that. We cannot link the two longitudinal tests, but that's not necessarily a problem. I think for me,
it's still quite powerful if people are demonstrating, you know, that they're, you know, they might have done a sleep study and it's changed what the treatment is, and they're on a different kind of level of management, and that's actually quite helpful to know that that's changed, isn't it? So yeah, and it might take the pressure off the families thinking, I've got to get, you know, this average when it's variable, and they can just say that actually this is it, and then it's changed. So that's a good discussion. Thank you, everyone.
Yeah.
Anything else? I realise it's very late for people. Mariana, did you have something you wanted to ask?
Yes. We participated through the Lyon hospital, I think, and they sent the data to UK. We signed a consent for that.
Lyon contributed with many patients. Of course, I don't know who is who, but yes, we do have quite a few, and thank you for that, actually, because yes, we do have quite a few EG from Lyon.
Yeah, they received us for 24 hours. So it's not a long time of observation. Is it enough for the study?
Yeah. For the EG study, we require just 1 night of sleep and some wakefulness, like 1 hour before and after wakefulness. That's enough.
Okay. And regarding the questionnaire, I only thought, because we had the meeting today, about to ask the French families if they are comfortable with English, and a few of them are, so they may complete the questionnaire so in English directly, maybe. So that could be good.
Yes.
Perfect.
Yes, and that would be great.
So we could distribute that link as well to Mariana in France if you don't have it, and also anyone else that has contacted their organisations. And if anyone wants to speak directly with Simona about it, is it okay to pop your email in the chat? And
I do it now.
Perfect. And then the different groups can get in touch. So thank you very much for your time. It's late in Europe. And thank you, Simona, for giving up your evening to chat to us.
Thank you for joining.
Hopefully we'll get loads more and we'll be able to hear from you in the future about what you found.
Thank you.
Thank you. Thanks so much, everyone.
Thank you, everyone.
Thank you.
Okay.
Bye-bye.
Bye.